Hello friends, welcome to my channel. I am Cancer Advisor. Today I am going to talk about how people with cancer can avoid getting infected with COVID-19. Reported studies state that cancer patients are at a higher risk of severe illness if they get COVID-19. So, individuals with cancer should consider two different strategies to reduce their risk of corona infection. First is to ensure they take appropriate precautions to avoid unnecessary exposure to the virus. The second is to consider changes to their treatment schedule that could be implemented to reduce their risk of infection. Most of the hospitals are strictly implementing no visitor policy. So, check with your hospital staff prior to starting. Take prior appointment in order to reduce the time of stay in the hospital. Take extra precautions like wearing a face mask, frequent hand washing, carrying a hand sanitizer in pocket wherever you go and use it frequently in public places. Practicing the social distance all the time is of a paramount importance. Avoid the public transport and crowd in public places. Earlier studies showed that, for most people, the immune system recovers within a couple of months after completing their cancer treatment. So, the increased risk of infection is for people who are currently undergoing cancer treatment and people who completed it very recently. Those who have been treated for cancer in the past don't necessarily have a higher risk of severe illness. Recent study has shown that people with cancer that has spread to the lungs or those with coexisting lung problems tend to develop severe illness if they get COVID-19. So, they have to be cautious. Regarding cancer treatment, experts say that it has to be individualized based on a patient's tumor type, stage of disease and status of corona infection in their area. Because the risk of infection is higher in healthcare facilities, experts are recommending to delay elective surgeries, screening tests, and other procedures that are not considered urgent. Radiotherapy, hormonal treatment, targeted therapy and chemotherapy can be given according to the treatment plan, if healthcare provider deems the benefit outweighs the risk of COVID-19. Your oncologist may alter the treatment schedule or mode of treatment, as per the requirement to evade the risk. Alteration in the schedule, like reducing the number of fractions for radiotherapy, increasing the duration between the chemotherapy cycles and number of cycles depending upon the requirement. Your oncologist may change the for medication to oral treatment to avoid the hospital visits. Discuss these issues with your healthcare provider. They also recommend stronger personal protective measures and surveillance for cancer patients, especially for older individuals and those with other health conditions. The experts also suggested that, during the COVID-19 crisis, people should be encouraged to use teleconsultation services, especially for those on oral medication and for follow-up visits. Stay in communication with your cancer team, and keep up to date on new developments. Let them know if you have questions or concerns. The best thing is not to panic, and to focus on ways that can protect yourself, because those small things can be enough to provide an extra layer of protection. Be positive and stay safe. Thank you for watching.